Hello everybody, my name is Alex. I'm co-founder of Amass, and in this video I will show you how the Amass platform can help R&D strategy teams get an overview of different clinical assets in a certain indication area. So this is a process, maybe you're working on cancer for example, where there's a lot of competition out there that is changing all the time. Different modalities are being pursued, different competitors are emerging, but also different opportunities for an acquisition, for example, might come up. You want to be able to stay on top of it, but you also want to be able to do this in a way that you're used to. So in the Amass platform, you can actually reuse existing templates you use to getting overviews of clinical landscapes as documents, get those into the Amass platform, thus set up your own templates that you can use and share across your team, and reuse your existing workflows one-to-one, but just scale them much faster and much better than tedious manual work, which takes hours and weeks and days every single time. And let's jump in, let me show you. So I prepared one example here that is a template around oncology pipeline analyses, and then specifically looking at phase 3 assets around oncology. This might be similar to a template you have as part of your R&D strategy team inside your organization. Critically, we're looking at phase 3 assets for oncology, and we want to know which modalities are being pursued, but also overviews and slicing the data in different ways around specific subtypes of cancer and who's sponsoring trials in them. Let me go over to the Amass platform. So for this example, I want to now first reuse the existing template and create a template in Amass. I can do this by creating a new template under templates and then using a document. I can either upload a file here or choose it from my Amass library. So in this case, I already uploaded the template, and I will now generate a template in the Amass platform. Great. After a few seconds, the template is ready in Amass. On the top left, you see a placeholder that is for date. I can put in any date here, for example, a year. Let's say I want to focus this on 2026. And I get an overview here of the outline, the different sections that I had in my existing template. And in the middle of the screen, I can see different sections and topics that the Amass platform extracted from the template I uploaded. So if we're, for example, looking at phase 3 oncology assets by modality and a section here, you will see here the different modalities that we extracted from the template, but also a suggestion for which data context to look at in the Amass platform. Here we are suggesting to look at clinical trials and web. Of course, you can go in, influence this, change this. Also, again, reference your own data sets, your own documents here. If you, for example, have existing reports, internal documents that you want to use here. Great. The rest of the template, again, looks very similar to the PDF file that I showed you. So all the information is captured here, and it's captured in a way that I can also change if I want to, but more importantly, reuse on a monthly basis, on a yearly basis, and thus doing things that otherwise take weeks of work, doing them much more at scale, much more often, and thus providing me much more up-to-date insights around what is going on in the oncology space. So I can now click on Create Asset, which will run the template. You will see here that we provide an outline of the different sections and topics in it. And this will take a little bit to process. You don't need to wait for it to be done. Let me show you what the output looks like. Great. The asset is done now, giving me a very concise but still exhaustive overview of the oncology pipeline space around phase 3 assets. So at the top, you can see here that the Amass platform is providing a summary of what is really the most important things to be aware of. Of course, there's a search in ADCs being looked at, but safety and access gaps are a concern. In addition, we also show you a clearly summarized bullet point list of the key findings. Now, if you scroll down here, you see the executive summary. This is basically coming from the template that I uploaded and created in the Amass platform. And you can also see different tables here that we're showing you. All of the tables you can filter in, you can download to CSV and Excel files, and thus take further. If we're going through this, we also have the different split ups by different indications. So non-small cell lung cancer and breast cancer, for example. In each of these tables and throughout the document, again, you have references to primary sources So you can always go in and say, okay, where does actually this information come from? So this looks like this piece of information actually comes from a press release for investors from BioNTech that is talking about the specific trial here. You can, again, download the whole report as both a PDF, but also more importantly, share it with your whole team. So in this way, your whole team has access to the information. You can also share the template with your team, which allows your team to collaborate on the template and thus come up with an even better template for your next run, which again, you can start in a month or next week. All of this is work that used to take weeks and weeks of time. You can do this very quickly and very repeatedly in the MS platform, which opens up for a whole new dimension of competitive analyses around cancer, for example. Yes, and that's it. This is how an R&D strategy team can use the MS platform to get an overview of a certain indication area. You can try it out yourself. It's easy to get started. Just go to app.ms.tech.